The views and opinions expressed do not necessarily represent those of Access Fort Wayne, the Allen County Public Library, or any other supporting group. Access Fort Wayne is a department of the Allen County Public Library. If you or anyone you know might be interested in making a television show, please call 260-421-1250.
Hi, Dr. Rudy Kachmann, and welcome to our show. I have a guest here today, Dr. Ahmed, who is a specialist in being overweight, also board-certified family doctor. And we're going to have an interesting show today. It's about vascular disease. Dr. Ahmed, tell us a little bit about where you work and what you do.
I actually work in Activate Clinic in Van Wert, Ohio. And we usually take care of people who works in Cooper Farm and their families.
I see. And thanks very much for telling us. And you're also a specialist in obesity. You're certified in that. Tell us about that in a second.
Obesity medicine is a new branch of medicine. So we get trained and certified. We help people to lose weight and get them healthy and reduce the cardiovascular risk.
That is wonderful, and that's true. If they eat the right way, exercise, and cardiovascular risk goes way down. Yeah. So we can review a little bit the history and the science of it. About would you believe it, 1.5 million people have heart attacks every year. Wow. That's a lot of people. And about 500,000 of those die. And what it was interesting is, Dr. Ahmed, is that 50% of those that die, they just grab their chest and they die. No warning. Mm-hmm. No angina, which is a pain that people will have. Let me tell you about the difference a little bit between the angina, chest pain, in men and women. There's a difference. Yeah. In women, it can also be on the right side. Mm-hmm. Can be the right arm, the right axilla, the right jaw, the right side of the neck. Matter of fact, any pain between the pubis and the ears, any pain, right or left, maybe accompanied by nausea or dizziness, that doesn't even have to be there, can be heart attack or angina. Yeah.
Right. I remember during residency, patient with abdominal pain had a heart attack because it was in the lower part of the heart. So if the block is in the lower part, symptom would be not the chest pain, it will be upper abdominal.
Just a belly pain.
Yes.
See, so keep that in mind. They can be young. I remember as a neurosurgeon, I saw a patient with trouble right arm pain, 35 years old, pre-diabetic. So, and I got an MRI, and I thought she had a ruptured disc. And she, walking out of the office, had a heart attack right there. Mm-hmm. Fortunately, we saved her. But so it's very important. And about 500,000 people have strokes, get paralyzed or lose their speech, which is also a vascular disease. So when you total it up, we're talking about 1 million people that die every year from vascular disease. And I'll tell you something right now, it's 90% avoidable. Yes, because the general medicine is not teaching people how to avoid it. Okay, a lot of it is from type 2 diabetes, from not eating correctly. So it's 90% preventable. If you want to read about it, I'll name some books real quick for you. Dr. Katz, Disease Proof Your Life. Dr. Joe Furman, Endovascular Disease. Dr. Esseltine book, which I have right here, Prevent Reverse Heart Disease. Dr. Mark Hyman, many books on it. Dr. Colin Campbell, China Study, End of Diabetes books that I wrote. All these confirm what we're going to speak about today. So this is a scientific, not a wishful discussion. So the leading, it's a leading cause of death, more than cancers. Yes, more than cancers. And 50%, no warning. That's why it's very important for you to know this information. It can occur even at a young age. Yeah, a very young age. Heart attacks can occur in the 20s, occasionally even at teenagers. The three main books I'll be referring to will be The End of Heart Disease, Dr. Joe Furman, right here. I'd really like you to maybe have a read of that, especially if there's family history and you've had a heart attack. You got to know this. Just to take the pill is not going to do it. You got to, because some of these things that you have done sometimes aren't indicated. Okay, like angioplasty, heart surgery, for example. Maybe when you're stable, and maybe you could consider changing what you're doing, how you're exercising, what type of food you're eating. I can teach this to you. And some people need both, but certainly anybody who has vascular disease needs to at least do this. Another book is Steve Masley's The 30-Day Heart Tune-Up. He's in Florida, and I've read this a number of times. I think it's a very excellent book to read. And then Dr. Esseltine of the Cleveland Clinic, which is a huge heart center, Prevent Reverse Heart Disease. He took over 20 patients, and he taught them how to eat right, him and his wife Nancy, and proper exercise. And especially if you have advanced heart disease, you've had some heart surgeries, angioplasties, that's the book to read, because he's more stricter than any of them, strictly a vegan way of eating. But eat all you want of the right foods. He has proven that heart disease is preventable, stoppable, and reversible. The 20-odd patients that him and his wife Nancy taught them how to cook, how to exercise, and all that. After about 20 years, I think 18 are alive, and they were the most advanced cases they had at the Cleveland Clinic. They're alive today. Yeah. Wow. Wow. So there's proof in the pudding.
Can I add something?
Yes.
So this is the book. If somebody is computer savvy or phone savvy, you can actually download in your phone. And this book, I also download the summary. So it's about 20 minutes while you're driving. You can listen to it. A good summary in 20 minutes. Fantastic way of learning.
Thank you so much.
Yeah.
Yeah, I even repeat it. In 20 minutes, you can download the book and listen to it while you're driving.
Yes, that's the idea.
You know, actually. I didn't know that. And he's a friend of mine. He's coming to town in September. I'll tell you when he's here, so I want you to meet him.
I'll be
you
there.
Told me that.
Yep.
And I beat him in tennis last time, though. And but you know, some of us don't have time to read or don't want to read and to listen to it. I'm going to actually do that. That's just wonderful.
So there are two things here. You can have the whole book.
The whole book.
Or summary. Summary is 20 minutes.
Summary. This is.
That's just wonderful for me.
It is wonderful. Yes. And information. And when you can prevent this disease, or if you have it already, you can even reverse it.
Yes.
Because what he's teaching is what's in these other books.
Yep.
I'll be honest with you. We have about 300,000 miles of blood vessels and capillaries in our body to keep healthy, okay? Some of us develop what are called plaques inside these vessels, okay? They're made from cholesterol and fibrin and fat. And they'll demonstrate these, for example, on CT angiograms, MRI angiograms, or actual angiograms. But these big stenotic arthritic plaques are not the main problem. It's the softer ones that cause a bulge in the vessels, which you could pick up actually on an ultrasound test, for example, in your carotid or in your heart. They're the ones most likely to kill you because they only have a very thin layer covering, and there's fat underneath and some inflammatory cells. And when they rupture, they rapidly your immunity attacks them and the clot forms trying to get to stop the bleeding, and they're the ones that obstruct their blood vessel, and they're the ones that are more likely to kill you. So just as stenotic lesions, they'll demonstrate an angiogram, they're not necessarily the dangerous ones. So when they do angioplasty on you, for example, they're heading for the big plaques, but usually that's not the problem. It's the little guys. Mm-hmm. The little guys. I just want you to know the difference. And they'll order tests, for example, a calcium score, which mainly reflects these big arthritic plaques. So if you get a CT calcium score, that's not the end of you. That's not the end of you. I mean, that's part of it. You're better off if you had a normal score, but they don't tell you the whole story. So what are different tests that you can run? You know, blood testing is important, and they have now advanced blood testing, which is more important just than to get the cholesterol or LDL or HDL. What in the advanced, because of the LDL level, you know, 150, odds are you won't have a heart attack. The Framingham Heart Study proved that. But they're now refining it further. You can have advanced blood fat testing, fat profile testing, which picks up the very low density LDL, and that's really the killer. The big LDL is a fluffy little ball, goes through the arteries and transports nutrients and hormones, and is important. That's not the real bad one. It's the very low density LDL where you count particles and particle size. They're the ones that hit every crack and bifurcation where blood vessels divide, and they're the ones that cause most of the atherosclerosis. And so you need to get an advanced testing to catch that, and then to action. We have treadmill test, ultrasound, actually, of the carotid artery. Dr. Steve Masley determined is about 95% as good. If he does IMT testing, which is an ultrasound. Advanced ultrasound is not always available. The regular ultrasound is, but the IMT a little more expensive. But he uses in his office, and is much more accurate because it shows actually the plaque very well, not just the narrowing, which you see in ultrasound. It's 95% as good as an angiogram. Wow. It's right in this book. Mm-hmm. Right in this book. So I'm not saying don't get an angiogram, but kind of keep that in mind. Can I have an ultrasound? Can I have an IMT testing of my carotids? It shows how stiff they are and the atherosclerotic plaque. Mm-hmm. So we do treadmill tests where they put you in a treadmill and you have to exercise a bit, and they slant it a bit, and it's pretty good for the atherosclerotic plaques, but they found, again, it's not that good for the small plaques. Mm-hmm. So it takes a combination of things. And the calcium score we mentioned. So what can you do to help vascular disease or prevent vascular disease? Nutrition is extremely important. Mm-hmm. Nutrient-dense foods of color, okay? Vitamins and fruits of color. You can add mushrooms, onions. They have in them vitamins, minerals, phytochemicals. It's their interaction, their symphony, their mosaic, their rainbow of interaction that lead to good health. Yeah, and you can eat all you want because the nutrients in there will turn your appetite off. I know I have a smoothie every morning, and I highly recommend that, where you take kale and vegetables and some nuts and seeds and curcumin and in there. I have a smoothie every day. I have one today. Did you have one today?
Not today.
I'm trying to teach it to you. Yeah, because it fulfills your nutrient need. And to me, that's 50% really of health, to have a smoothie every day. You won't get hungry for a long time. And it'll help get rid of type 2 diabetes, which is the cause of about 50 diseases, you would think, through your obesity teaching. Majority of people that have overweight, judgment-free zone, okay, who are overweight are diabetic, aren't they?
Many of them.
Over 90%.
many of them either it is now or down the road.
Yeah, or down the road.
Yeah.
And that, I think, is critical in this testing. I mean, there's a road to diabetes, a road to vascular disease. You know, they talk about pre-diabetes, HbA1c 5.4 to 5.7 to 6.4, and then you get diabetes. Some people use the number 7. I think you use 7, HbA1 7. But there's a time before pre-diabetes where we have metabolic syndrome. Okay, what's metabolic syndrome? We can determine that partly by vision. Your waist measurement is number 1. Waist measurement. Male should be under 27, female 24. And that can vary, you know, a little bit, but, you know, so when I see somebody with a big pot belly, there's a judgment-free zone. To me, they're pre-diabetic, and they probably get vascular disease already. They studied the Korean soldiers that died in the war and the American soldiers, and they found all the American soldiers, they had fatty streaks from cholesterol already, almost every one of them. While the Korean soldiers themselves, the North Korean, no evidence of it. Wouldn't you love to go to North Korea and test about 1,000 people and see what the situation is? They've been starving, but I wonder what the heart attack rate is. Probably very low.
Yes.
I'd love to do it, but I may never come back.
Doc, nothing to change the subject. About the cholesterol check, I think we need to let the audience know that the regular cholesterol profile, which is total cholesterol, triglyceride, LDL, HDL, you get a profile. This is somewhat like a concentration test. It's not very sensitive.
Yeah.
So you may get a good result in that way. Doesn't mean that your risk is not high or low. So you do the advanced test. So advanced tests involve directly measuring the LDL that Doc was talking about. It's really important to do that. Also something called ApoB, which is also an important test to see what is your risk is. So if we have the baseline test and then somebody puts on some cholesterol pill, you can actually follow those numbers to see truly if you reduce the risk or not, instead of the regular test. If regular test is already high, you probably don't need that advanced test. But if the regular test look normal, but your risk is, you know, for other comorbid condition is high, you should do it.
Yeah, I think thanks for saying that. I mean, what he's really saying is, that if the routine test is abnormal, is abnormal, you need to proceed to the advanced testing I was speaking about. And I also wanted to mention the HDL, the good cholesterol, which you know should be in men 40 and over, and women it's around 45. About 50. They now find out that they have HDL 2 and 3. And 2 is the good guy, and 3 is the bad guy. So they've broken that apart. So when you do advanced testing, you get those results. And then we talk about lipoprotein A and B, right? Some people have lipo A quite high, but understand, from what my understanding is, there's not much you can do about it. Doesn't respond much to medicine, or does it?
ApoB will. ApoB is a very good sensitive test. In fact, if we have ApoB baseline, and then we start in medicine and all the lifestyle modification, I would probably follow ApoB than a regular lipid test.
Is anything about lipo A? Is B is the main one, huh? Okay, good. Thanks for clarifying that. So what I'm saying is, before you consider, unless it's an emergency, you know, you go to the emergency room, you get a chest pain, they're going away, they want to do angioplasty or surgery, we're with you. You know what I mean? But when you get done, we're saying, then gain some knowledge and either read or listen to some of these books I'm speaking about, participate in your health care, because you might be able to get rid of the disease. Don't otherwise next year I mean, angioplasty may open up that vessel a little bit, maybe take a clot out of there. You still got vascular disease. That's the point I think cardiologists a lot of times don't stress. You still got the disease. They just save you for the day. The future is up to you, right?
Yes,
I think. And so, don't just say, "Well, I'm over my heart disease. I had my surgery. I had my angioplasty." No, they just stabilize you at that time. You still got extensive vascular disease. You need to do something about it. A lot of people don't know that. So I'm glad we had it.
Can I give a crude example of this? That when I talk to my patient about this who had clogged artery, I tell them that, well, your sink got clogged and you went to that Roto-Rooter and open it up. If you don't change your behavior, throwing all the junk stuff in the sink, it's going to come back again. So you better start working on lifestyle to prevent that clogging.
Exactly right. Thank you for emphasizing that point. You must participate in your health care if you have vascular disease. We spend about $320 billion a year on vascular disease. No, I think it's probably more than that. As a physician, we need to teach you how to get well past what happened or prevent it. You want to live to be 100, you eat the way we speak about, you probably will not have vascular disease. 90% chance. Wow. I mean, that's fantastic. You eat a nutrient-dense way of eating, exercise maybe a half hour a day, for example. We Americans are eating the SAD diet, diet of sugar, fat, and salt. Dr. Furman calls it the DAD diet, sad, deadly American diet. We're eating 54% processed food, about 32% meat, vegetables 11%, when it should be vegetables 60, 70%.
Yeah.
We're eating the wrong type of food. When they look at nations where they're eating mainly a more vegetarian, more vegetable type diet and more fruits, heart attacks are almost unheard of.
Exactly.
Yeah. And the China study, Colin Campbell, he provided the evidence that it's a huge study in China. Good.
Dr. Furman's also mentioned one thing I kind of too strong. He said that if a physician treating you with a prescription, that's probably not a good practice. Prescription only. We need to really put the nutritional part in the treatment.
I think, thank you for adding that.
Yeah.
And it's not a script to the ill. You must participate in your health care, gain some knowledge, which we're providing for you. And as you gave a lecture on this, actually, at some college students at Trine, and I'm telling about the danger of sugar, because sugar gets converted to triglycerides, and that's what makes insulin resistance, and that's what leads to insulin goes up, and high insulin levels lead to vascular disease, inflames our blood vessels. I mean, the Framingham Heart Study showed that if your cholesterol around 150 or under, the rates of heart attacks go down. Now they're also saying you're very low density LDL, if it's say less than 80, you probably won't get a heart attack. But again, we like to define it further into the advanced tests to really catch it.
If I can add about Framingham.
And Dr. Esseltine would say, don't eat anything with a mother or a face. He's trying to get you away from meat products. But like Dr. Furman says, a meat cup 2 or 3 times a week, organic. Unless you have advanced disease, you get way advanced disease, go to Esseltine, and you don't want anything like that to really detoxify, your body becomes very important. So fiber is your friend. Eat foods with fiber, because a lot of the calories won't be absorbed. The blood sugar won't just shoot up in the air, and the insulin levels goes up, which causes a vascular disease. So you need to look at the quality of the carbohydrate that you're eating. Does it have fiber in it, or is it just white bread, nothing but sugar? Dr. Furman even has ANDI scores, ANDI scores. Like if you eat, put kale in your smoothie, for example, kale, it gives 1,000 points. White bread, 10 points. Donut, what do you think? 15 points. Okay, so so you need the quality of the food, the carbohydrates, the quality, like black beans and a potato. Generally, mainly sugar. Although, you know, if you have normal weight, you might get away with it, you know what I mean? Mm-hmm. But it causes insulin level to go up. Maybe eat sweet potatoes, for example. They're a little healthier for you. And animal protein, they generally don't recommend because it has insulin growth factors in it, nitrates and nitrites, and a lot of it is from non-organic farms and full of hormones, anti-inflammatories. Matter of fact, most animal meat you eat today has been fed. I mean, what you eat is what the animal ate, okay? You eat the animal, what the animal ate. If it has been fed out of a trough of corn, which has been genetically modified, full of hormones, pesticides, and the animal eats it, and then you eat it, what do you think? Not very healthy. You have to watch that in fish, too. Fish off of farms a lot of times is corn fed. It's not fed by plankton and food from the sea. So you have to ask, is this salmon come from the sea? And that's very tricky because a lot of times today I find, you know, I at the country club they're serving Scottish salmon, so I really pinned them down one day. It don't come from Scotland. It comes from a pond, from a pond. So IGF-1, which can cause congestive heart failure, and it's a lot in animal meat. So you have to watch for that. A heart pumps about 3,000 calories a day. Man, that's a worker. Yeah. That's really a worker. So, but some people, you know, get a warning about how trouble they have angina, for example. It doesn't kill them, but these people are the ones that can't just take a pill to the ill to relieve the pain. They must do something about whether they're exercising or not, or whether or what they're eating, and do some other things. For example, I used to tell people, you are what you eat. Almost. You are what you digest. Almost. You are what your blood work is. Okay, I thought that till I did some more reading here. Now I'm actually thinking, and Dr. Stephen Masley in his 30-day heart tune-up says, you are what your exercise tolerance is. Yeah. You are what your exercise tolerance is. And check with your doctor if you're doing these things. So, you know, we use treadmills, like where I work out at Planet Fitness. I noticed the other day they added a stepping machine in the YMCA, and certain testing centers use steps, a 3-minute step test. That to me would seem, if your doctor okays it, an excellent way to find out your exercise tolerance. So yeah, it has these steps, but again, you got to be approved for that. And that will tell you, and it's well described in Steve Masley's book, and you can get it online also. That will really tell you the condition of your heart. So it's not just what you eat, what you digest, or your blood test. We've advanced it to actual functional test. Does the airplane fly? So that's again, check it with your doctor. You know, so you should avoid, especially if you're having a problem, or for any of us, that holiday meal at times. I mean, if you say have some vulnerable plaque and you may not be aware of it, and you go and eat out and eat nothing but fat and sugar, and you put in a few drinks, that plaque that you have that has this thin layer of covering on it, you could bust the darn thing and never wake up from going to bed. That happens to a lot of people. Remember, heart attack without warning. They found when they checked the serum in your blood and put it in a test tube, it's supposed to be lightly yellow. You can about look through it. After a heavy meal, it can almost look black.
Mm-hmm.
Can you imagine what that's doing to your heart? Can you imagine that's doing to your heart? That's where the unannounced heart attacks come from. So it's not the hard calcified arthritic plaque which they're trying to sell you on and operate on and do angioplasty on a lot of times. That's the danger. It's the number of soft plaques that you have. On page 54 in Dr. Furman's book, which I'm going to read to you here a little bit. He has a table, and what he's saying is you should have nutritional excellence, not drug excellence, okay? And he puts in the sentence here, and he wrote it, it's in his book, okay? Invasive cardiac procedures and surgeries are not effective. He's reviewed the studies. They're promoted a lot, don't always work, but for some people they're life-saving, you know, but consider nutritional excellence as being, you know, very important. And there are complications of having angioplasties, for example. You think, oh, it's a very low-risk test. Let me show, and Dr. Massey has in the stories of two of his relatives who were severely disabled from the angioplasties. Yeah, one had a stroke, another one died. Let me read you some of the complications that can occur from them. Sudden death, stroke, heart attack, bleeding, infection, anaphylactic reaction, blood vessel damage, kidney and brain damage, need for emergency surgeries, all can occur from angioplasty. So the risk is not that high, but it's there. So if they explain this to you and you have, say, stable angina, which is not a clear, from my reading, a clear indication for angioplasty, okay? They see a bunch of things, but you're stable. At least, according to my reading here, they should offer to you a nutritional and exercise approach. Yeah. It's just unstable progressive angina that made you have an emergency surgery or angioplasty. They save a lot of lives that way. But the point is, the nutritional conservative approach should be brought up. So it needs to be discussed. Okay, it's an option. It should be presented to you as an option. I already mentioned the books I encourage you to read. And I mentioned already the ultrasound test, which is what's routinely done, which shows you whether you have narrowing of the carotid, say, okay, in the heart. The IMT test, which you can ask about, which is available in some areas, it shows you the actual plaque itself. And the good news is that if you watch how you use your fingers, your fork, and your knives, you can stop, prevent, reverse a lot of this disease, and you must learn about that, okay? Dr. Stephen Masley, in his book, is talking about lifestyle management. He runs an institute, I think St. Peter's, Florida, I think it is, and he also has an excellent DVD, which I reviewed, and he actually took a course in cooking. Yeah, but of all the factors, though, your blood pressure is the most important one. Yeah, and especially the systolic blood pressure. Mm-hmm. But they're constantly changing the reading of it. And another way is, if you remember, I said testing it. For example, with exercise or a treadmill, your heart should rapidly recover. That's a sign of good health. Mm-hmm. In other words, that your pulse rate goes up during exercise, everybody's, but it should drop quickly after you stop. Mm-hmm. I jump rope before I play tennis, for example. When I'm playing indoors, I have a rope thing in my bag. And I'm slowly getting pretty good at it, actually. I mean, that's a quick way to get your heart rate up. You know, I count to 100, man, it's pumping. But I noticed that my pulse rate, you know, show up quickly, 110. and it drops very quickly. That's a good sign. And I hope that continues. So fitness is really a great way to, so number one is fitness, and being overweight is not a good sign. People who are overweight consistently have diabetes, vascular disease, okay? And the IMT test I mentioned already can be available and very good for you. So exercise, walking, you know, they were speaking about 30 minutes a day. You read about that 5 days a week, but especially in women, they're thinking now, like Dr. Masley's thinking, maybe an hour a day. And if you can do high intensity intermittent, you know, walk, normal walk, and then speed up for 30 seconds and walk normally, that's high intensity intermittent training. That's even better for you, for your heart. And managing your stress is important. And how do you teach your patients? I know with people that overweight, stress problems, they're eating to make themselves feel good, right? What do you tell them to do about stress?
Stress is a very complex issue. A lot of personal issues are there. I'd like to try to kind of explore what actually contributing to that. A lot of time people will handle their stress differently. So if stress is not causing any big symptoms, we are okay. In our life we have always different things going on. The individual who are having difficulty dealing with stress, having symptoms affecting their relationship, affecting their work, affecting their sleep, only then we need to intervene with different intervention that we have. So definitely therapy is a good way to start to learning about the stress and stress management. We do have a therapist in our office. We always help the individuals to start talking with that therapist.
Yeah, thank you. And we're all different situations. Life is stressful for everyone, let's face it. I mean, it's like a stock market, up and down, then it dies. And I deal with my stress. I get up in the morning, I give the wife a hug, that's one good one. Then I hug my cats who've been sleeping on the left side of my chest. I think they feel my heartbeat. Then I go downstairs and I watch the birds and the bird feeders and the rabbits feeding. And then I take a walk in nature for 30 minutes. I look at the trees, and like having the last few days, the red-winged blackbirds are singing at me. Oh yeah, they track me. They're getting closer and closer. I had someone tell me today what I ought to do is take a glove and put some nuts and seeds in them, see if they'll land on my hand. I don't suggest that to anybody, but I think I'm doing it. I just kind of get into nature. Makes me feel good. You know, they sing to me, I tweet back to them. That's stress reducing. And the walking, for example, and I look at the trees and the leaves and sing a song, that relieves my stress. Play tennis at night or something, or now I'm playing pickleball. All stress relievers. We all need, some of them. So Dr. Stephen Masley talks about 5 classic risk factors. One, he is talking about the cholesterol, and he's speaking about the LDL and the HDL, the HDL2, and breaking it further down, the particle size, the particle number, the advanced test, for example. And in the LDL level actually tracks the level of the nutrients that you're eating. Yeah, if you're not eating the nutrients, the LDL tends to elevate. And the HDL is the trash collection that goes through your vessels and tries to pick out the bad fats and get rid of them through the gallbladder. So he also mentions a very important test is the total cholesterol HDL ratio should be less than 3.5. That's a good initial screening test. Yeah, TC/HDL ratio. Total cholesterol to your trash collector, the HDL, important. And he mentions that about statins. You know, I talk to a lot of people that are on statins. Could you tell me about what are the indications for statins?
That's a good question. 20 years ago, anybody has high cholesterol, we used to write cholesterol pill or statins. A few years ago, American Heart Association recommended, oh, wait. The benefit doesn't outweigh the risk. So there are mainly two groups they really recommend that statins. One is person who had a heart attack in past.
Okay.
And statins has mainly two effects. One is it will reduce your cholesterol, and second effect is it's actually kind of make your artery wall lazy, so it opens up. So we call it pleiotropic effect. So statins, even though your cholesterol is normal and you had a heart attack, you probably want to take it so that the artery is open, so that you reduce the risk of another heart attack. And the second group is diabetic. Patient who has diabetes, they have very high risk of heart attack, so cardiovascular disease. For them, statins are recommended. So those are the two groups I really focus on, and rest of the people, every individual, you have to look at the individual risk. Only then I'll discuss first the lifestyle change, then maybe recheck, and then if they are struggling, only then you have to justify it.
So if they're diabetic,
yeah,
or they've had a heart attack,
yes,
those are the main indications, because they do have side effects.
Yes.
And I read actually that they increase the blood sugar a little bit.
Yes, there are studies
and so
on that
using
one, yes.
a diabetics, you got to watch the sugar a little more. Mm-hmm. The other thing is that they affect the mitochondria, your energy level. Mm-hmm. And some people, it really gets out of hand.
Yes.
They have statins and they're laying in bed, can't get up, because the mitochondria, the energy factories of every cell of your body. So you got to watch that. A few people are just devastated by taking them. So things you got to know. Things that you have to know. Do you use the HbA1c to track your diabetics, or does that catch us later in the stage, and would we be better to track them with serum insulins?
Which test are you talking
about?
A1C.
Yeah. Mm-hmm.
A1C?
Is that a good tracking test?
That's a very good tracking test, and that's recommended by American Diabetic Association also. Mm-hmm. If you have poorly controlled hemoglobin A1C, for example, if it is more than 6.5, you should get every 3 months to check that, because it's a 3-month test. So don't do it too early to see whatever intervention you had placed. So your goal is get you going with less than 6.5. Now I have some patient diabetic start off with hemoglobin A1C 9, which is very high, poorly controlled, and they become motivated, activated. They wanted 5.7. Few of them were able to do it. 5.7 and less is actually normal, and that's we call it remission of diabetes.
I gotcha. Thank you. The HbA1c is a combination of proteins and sugar.
Yes.
In your blood. It tracks 3 months worth
average.
On the average, so that's very helpful. What I've read, it's a good tracking test, but to screen that originally, you'd be much better to aim for metabolic syndrome.
Yes.
And what is metabolic syndrome? I'm going to name about 6 factors that make it up. One is your waistline. Okay, we spoke about that. Your fasting blood sugar. Okay, and also your fasting insulin. Yeah, you're fasting. Yeah, that's the latest thing, because your blood sugar may be normal, but your insulin is elevated. We were catching you very early. Number 3 is your triglyceride level. It should be under 150.
Yes.
And your blood pressure. What do you consider to be normal blood pressure?
130 over less than 90. The diastolic.
130 over 90 or so. Yeah. And as you're getting sicker, is systolic, the upper one that goes up generally, right? It's the upper one goes up. And then another risk factor is low HDL. Remember, that's the garbage collector that cleans out your arteries, and especially the HDL2 that you have normal, and don't have much of the HDL3 which is the bad one. Number 6 is inflammation. Measure that. CRP test, homocysteine test.
If I can add we call it poor man's test for insulin resistance. You take the triglyceride, you divide by HDL. If it is 2 or higher, most probably you are insulin resistance.
Yeah, and the reason you call it the poor man's test is that you could use it as a screening test and just order one test.
Yes.
$10, $15.
It could be less than that.
Could be less than that. I've talked to LabCorp, and they've been accommodating to me. And a wonderful testing facility, and they. So that's if you have somebody who has no money. That's
wonderful.
Triglyceride HDL ratio.
Yep.
And it is. And there's a real goodie for you. Because people say, "Oh, I can't afford the test." Many times. I think that's excellent. And now we have the new risk factors, which we spoke about earlier, so I'm going to repeat them a little bit. And that's the advanced lipid profile, which we speak about the HDL 2 and 3, right? And remember we said the big LDL, the big number, may not mean much. People can have a very elevated LDL, and if the very low density L is normal, not much risk, okay? Alcohol, they mentioned in Masley's book, particularly increases the HDL3.
Okay.
You're an alcohol drinker, so because alcoholics do have an increased rate of vascular disease, So they may look pretty good otherwise, but HDL3 is elevated. It's so important to test for that. You should exercise at least 30 minutes or more, because 20 minutes of exercise has been found has no effect on the HDL3. Yeah, good to know. So we have to increase it a little bit. If you're overweight, that increases the HDL3, the bad one, okay? And also your blood pressure go up. And I found, and this is in the literature, the first symptom and sign of diabetes many times is elevated blood pressure. Of diabetes, one of the first signs. Dr. Masley also, instead of necessarily using the body mass index, which can be inaccurate in people who have a lot of muscles, for example, he used the electrical impedance test. You use that periodically?
I wish I could. There is a machine to do that.
There's a machine that does that, And many different machines now. He's using one in the office, and he claimed it didn't cost that much. So I'm going to look into that because that's another way of measuring. I go to health fair sometimes, and they will measure your electrical impedance. So when you have and number 5 risk factor is inflammation, which can be due to too much sugar, can be the wrong fats. Your body could be on fire. When I see people that are overweight and vascular disease, I consider they have a chronic, slow burning fire in their body. All the vessels are inflamed. Many times present as numbness in the hands or the feet, loss of vision, for example, commonly seen in diabetics. What it is from inflammation of the blood vessels. And of these ones that I've mentioned so far, that if you get 2 or 3 of those 6 I mentioned there, you probably have metabolic syndrome, but that could be caught very early in your disease process. So to have those tests done, what I like to see, I like to somebody have yearly testing, put it in a book or on your computer, and then yourself, better off yourself, or your doctor could follow that and see if you're approaching pre-diabetes or diabetes. Your metabolic syndrome, you take corrective action. It wouldn't take a lot.
No.
Knock off, 7% of your weight maybe at best, and you're going to live to be maybe 120 now.
Yeah, I think it's kind of like should be like a Christmas gift to do a routine blood work and some body weight check, blood pressure check, so you get a annual report where you are, and then you can go from there and take action if needed.
Yeah. So let's review a little bit, gauging your risk. Gauging your risk. Remember I said, in the end, the best one is really like a stair test.
Yes.
Yeah. 3 minutes, bingo. Right. You know your condition. You've really flown the plane, okay? But let's go through the list again a little bit here, because we have it straight. Your LDL, including the very low density LDL, if the LDL is elevated. If your HDL is too low, that's risky. What's the level of the HDL 2 and 3? Your blood pressure, okay? What's your blood sugar? I mean, you might be pre-diabetic. Some people will say 100, other people will say 90. When I saw somebody that we were very familiar with every day on TV, when he was in the primary, he said his blood sugar was 99, he weighed 230. Then it was retested recently by the Navy doctor, and he said he weighed 240, and he said he lived to be 200. You believe that? I don't think I believe that. And then the waistline measurement, okay, we spoke about that as being important. Your BMI, CRP, whether there's inflammation in your body. Are you smoking? Are you drinking a lot? Remember, drinking affects the HDL3, it drops that, which is the garbage collector in your arterial system. Are you exercising? A good way to also to measure your body's ability is to use the METs, M-E-T, metabolic equivalents, and an average would be around 12. That's what they use for the treadmill test. If you're 15 or over, you may live to be 100. And I didn't mention this before, but especially Dr. Esseltine, Dr. Furman would say avoid dairy products. And Dr. Kachmann, in his book, The China Study, he brings it up. Read a book called Whitewash by Joe Keon. Read it. Make up your own mind. But I tell you, if you drink milk after that, I would be surprised. Cow's milk is meant for baby cows. If you really study the casein in milk, the protein, the casein is very carcinogenic. Dr. Colin Campbell says it's the most carcinogenic chemical in the world. Yeah, he says that. And most of us lose the enzyme to break down the sugar in milk, galactose, okay? And we have galactose. We don't have that lactose enzyme. Some racial groups don't have it at all. Asians don't have it at all. Blacks maybe 60%, and whites maybe 40%. Nature designed it so that after age 4, we lose that enzyme, because that was about the time of mother's milk. Mother's milk is the healthiest thing you do for your baby. We have a very, our brain is mainly fat, omega-3 fat, and if you're drinking mother milk, it's full of omega-3 fats. You're drinking milk from a cow, it's full of hormones and pesticides, because they keep the cow in a cage to increase its yield of milk. And when your child or you drink this milk, is what you're drinking, a hormone-laced milk. Even 2% milk is 35% fat, okay? So milk's not healthy. But if you need some in your coffee, some almond milk, or soy milk, I think it would be fine. And if another risk factor would be family history of vascular disease. If that's the case, everybody seems to get at a young age. Then especially important that you get the advanced blood testing to see if there's something you could do about it. I would certainly eat nutrient-dense food, 70–80%. If there's a strong family history, people are dying very young, every one of them, I might consider Esseltine and 100% vegan type diet, and exercise regularly, learn to cook yourself, and avoiding fast food. Dr. Furman wrote a book called Fast Food Nation. That's also worth reading, because they strip the food of its nutrients and make sure that it's sugary enough that you just keep on eating. And when and government supports the price of sugar, believe it or not, and that's not nice. They do it, lobbying money supports the price of sugar. You believe? Yeah. I mean, let's face it, sugar is addictive. I mean, Dr. Furman would say maybe it's a poison, okay? So aerobic fitness, where you're breathing, is the best test of all, even above the blood test. Remember I spoke about that? And the step stair test, okay? By the time you get symptoms from heart trouble, usually the artery is blocked about 70% already.
Wow.
Yeah, so you have advanced disease. So you want to get other testing done, aerobic testing done, progressive blood tests over the years to give you some idea. And so in our blood vessels, our 300,000 miles of blood vessels, there's a very thin layer. It's called glycocalyx. It's a protective layer. And then is the intima, one layer thick throughout your body. And in that endothelial layer is an enzyme called the lipoprotein lipase, LPL enzyme, okay? And that enzyme is turned on and off whether you're getting up or sitting all day. Yeah, and that you hear about sitting disease now, and we find that you sit for 2 hours, that LPL enzyme gets turned off. It's like smoking a pack of cigarettes. Yeah, that's and they determined that from research, outer space research. Yeah, because the astronauts came back and their muscles went away, and they discovered. And then the science of sitting disease has come out. I have a book on Amazon called that. It's worth reading. So in summary, what we're saying that you can avoid vascular disease 90% of the time. Dr. Ahmed, would you agree with that?
Yes, I think Dr. Furman also agrees with that.
Yeah, and Dr. Furman agrees with that. And Dr. Maslow agrees with that, and Dr. Esselstyn agrees with that. So you gather information. So unless there's an utter emergency, it shouldn't just be to the angioplasty or to the operating room, unless it's a very emergent situation. You just got to do what they say, and they're good at doing it too. Those procedures have saved a lot of lives, so I'm not against them. What I'm saying is, beyond that, you need to be taught prevention. Maybe before the problem started by your family doctor, big time. If he finds out you're diabetic, get rid of it. We'll show you how to do it. Watch our other shows. We put these shows on every week, about an hour and a half. One is always on diabetes. This one was on vascular disease. You can go on YouTube. And I've done some together with Dr. Ahmed, and he's a overweight obesity expert. He's certified in that. We could, if you want to personally talk to us, right now I'm at the Three Rivers Pharmacy, where I see people for nothing on Fridays. I already did today. And I counsel some diabetics and some people with addictions for free. We do this because we love you. And that's the reason that we're here. I think you understand now what vascular disease is all about. And you can attend our lectures at Lutherans, or look at YouTube, or read the books on Amazon Books. I got 15 books on there. And participating in your health care is critical. It can't just be to the ill. We're going to do this, and you don't know anything about what's going on. That concept, both of us don't agree with. Knowledge is everything. Thanks so much. See you in the next shows. Look at Facebook, Kachmann Live to Be 100. I'll see you there. I'll hope when you hit 100, I'm standing there dancing with you.
Thank you.
Bye-bye. Bye.